Welcome to Frontline, a segment that we've introduced to focus on the people who are working at the front lines in these times. Environmental health personnel on COVID-19 are protesting their exclusion from the list of frontline staff to benefit from government's stimulus package. The personnel are involved in surveillance, disinfection, isolation, and burial of persons who die from the virus. Ashanti Region branch of the Environmental Health Officers Association wants government to rectify that immediately, what it describes as an anomaly. Leaders say the members are on the burial team especially are exposed to a bigger risk, as they sometimes have to beg for personal protective equipment. Sometimes they even have to reuse ones that they've already used. Love FM's Erastus Asare Donko has more.
45-year-old father of 5, Adongo, an environmental health person. His job entails disinfecting suspected coronavirus-infested environments, preparing and burying of deceased persons who had been infected with COVID-19. Adongo has been actively involved in such activities since the first confirmed case and subsequently death of patients in the Ashanti region. He tells me the risk to his life is high, as he sometimes has to reuse disposable protective equipment or virtually beg for a new one to discharge his duty. Despite his exposure to the disease, he is not counted as a frontline staff and currently doesn't benefit from government's stimulus package.
You see, I'm a man who is a macra and bank. My wife told me when I was met me. Because somebody view baby. Somebody in the Tadi, I'm a fairy cemetery question, somebody in Tadi, and I'm sorry for far for. I will Tadi about coffee. Maybe you for me. At least that time when me by Casabi and boss, Bacasabi, I mean to say, you man work on a year, man. And tell you, me, Manama Trade. I'm a man who follow the emboss of panel. You see, I was here and so coronavirus to say about so chat. Sikaka Krabi, Adia so Yasane. It is Canandrian, our Cadrunas, daughters, Yabi.
Elvis also supervises burial of confirmed or suspected COVID-19 victims in Kumasi.
I could remember when we went to the Obuasi for the 4th burial. We went there and the PPEs were inadequate because the body was in the cold room. They do not have a mortuary where we have to dress up with all our PPEs coverall to go there and pick the dead body, which is in the body bag, into the casket. And right after that, all PPEs must be discarded. Then when we get to the cemetery, we have to use another PPEs, nose mask, gloves. All these things are utilities that need not be used more often. Immediately go nearer the body. After picking or doing 1 or 2 things, you have to change them. And this has been a very big challenge to us. Because
Adongo and Elvis represent many environmental health staff on local government payroll working on COVID-19 teams across the region. They say, unlike their colleague health staff, they have been excluded from government packages despite being exposed to the similar risk. The Ashanti Regional Association of Environmental Health Officers is not happy. Stella Gabriel is the regional president.
Your members of your association feel?
Well, in fact, we feel very disappointed and dejected. We have always been on the field together with other health workers. We are part of the rapid response team, the district management team. We also are in charge of disinfection, that is from the house of the infected person to even the hospital facility, and when the person dies, we take care of the burial. What can be more contagious than these activities that we carry out? Just like any other health worker, we have contact with the patient whilst alive, and when the patient passes away, we are being asked to take care of the dead body. And when it comes to enjoying a motivation or motivational package, they are trying to sideline us, which I think is very disheartening.
Head of Local Government Service, Dr. Nana Ato Arthur, says concerns of the environmental health workers have come to his attention, and he has forwarded same to government for redress.
In the current fight against the COVID-19 pandemic, environmental health officers take a frontline role, rubbing shoulders with their health practitioners on the field. When it comes to prevention, they are in people's homes. They are fumigating areas, disinfecting areas where suspected cases are. They bury the dead from COVID-19, but they are not counted as frontline workers who should benefit from Ghana's stimulus package. They are demanding their fair share of the national cake. Reporting for JoyNews, Erastus Asaridonko, Kumasi.
So as the story has been told, has there been a response? I'm talking to Richard Kofi Jordan. He's the General Secretary of the Mortuary Workers Association of Ghana. Mr. Jordan, thank you for your time this afternoon. What are authorities saying about your concerns? Have they said anything to you?
Well, for us as mortuary workers, what we know is that it will be a great mistake for government to say that mortuary workers are not frontline. We have seen letters that includes mortuary staff as frontline. So for what we know is that we are expecting the package. I mean, in April, we didn't see anything.
Okay, so hold on, let me just get this clear. Did you just say that you have seen a list that has your names on it?
Yes, yes. I've seen a letter that includes mortuary staff.
Okay.
So I don't have any doubt that anybody will want to say that mortuary staff are not part of it.
Did you see the list today?
No, I think the letter came on the 18th of April. 18th or 20th, yes. I think forwarded to someone there. But what I'm saying is that letter stated clearly those who are supposed to benefit from the frontline workers. The letter stated there was initial letter which came. Some people were included which they were not supposed to. So this very letter I'm talking about includes mortuary staff. So I want to believe that that is the government's position. Okay, so the concern is that even though you've seen your name on this particular list, you haven't heard anything? No, we are waiting for the calculation to go. Okay. We want to see it on our payslip. Unless otherwise somebody is disputing it, we believe that we shall enjoy same like any other frontline workers. Very well. Then I guess we'll come to you when that your payslip comes, and it's, I mean, when it is there, it's good news. We'll talk about it. When it's not there, I guess that will raise the issue again and get the responses, I believe. Yes, but meanwhile, the tax relief, I think some people have indicated that yes, they've gotten some tax relief. We are not talking about 50%, which is a major issue. I just want to do that clarification. Okay, can you say that again? I missed it. I mean, what I'm saying is that for the tax relief, and it started in April, some people have said that yes, we've seen it. It's reflecting on our salary. That's a 50% bonus on civil salary, which we are also talking about now. But even that one, that is what I said. I said, I have seen a letter which includes mortuary staff. And so someone comes out to tell me it's not correct. We believe that we are part of the front line. We are not the front line, we are front and last line. We play two roles here, both front line and last line. So ours is even more critical. You are indeed. And on this particular segment of the show, we focus on people like you, and we share your very personal stories with our viewers so they can appreciate the things that you go through. How has it been like? I mean, being a mortuary worker must be difficult already. But in these times, in these times of coronavirus, it certainly is as scary as hell. Tell me about your personal experience. Especially when we have to fight government every day for PPE. Just yesterday, I still have a complaint of a mortuary not having one single PPE. With everything that we've been talking about. Remember, this agitation of PPE started some 2 years ago. We talked about it. We even decided to embark on some strike a little. And then even before the conflict and during the COVID-19, we keep talking about PPE. We wrote to the ministry indicating that we don't have PPE. So I can tell you that we have a lot of our members across the country who do not even know how the PPE looks like. It means they've not been given. Recently, I heard the Minister of Health saying that they have conducted an investigation and it indicated that some people were hoarding and selling the PPE. I just want to be sure, I just want to believe that those people will be brought to book.
Okay. I think, Mr. Jordan, I think that what we can do also is that the next time we talk to you, if you can give us perhaps a list of the specific mortuaries or your members that are complaining about lack of PPEs, perhaps we can forward that to authorities and get them to respond as quickly as possible. Perhaps it's not reached them.
Well, that would be okay.
Okay.
It's so it's the whole country you are talking about. So.
Okay. Well, but these are your members, so it should be easy for you to coordinate.
Yes,
you know.
I can do that.
Yes. Let's work with that way. Mr. Jordan, thank you so much for your time and for the work that you're doing. Hopefully, will make it easier and better for you, so you don't get exposed yourself. Richard Kofi Jordan is the General Secretary of the Mortuary Workers Association of Ghana, and that's it for Frontline.